Okay. Okay, I can see the interpreter. Okay, hi, my name is Haley, and I just graduated from Gallaudet University with a bachelor's degree. Gallaudet University is in Washington, D.C. I did a study researching the effects of animal companionship on mental health in deaf and hard of hearing people during COVID-19. This is a summary of my study. I looked to explore the impact of animal companionship on mental health of deaf and hard of hearing people during the pandemic. I used a phenomenological qualitative methodology with an autoethnographic framework and analyzed the researcher's experience myself as well, so my own research as well. I did interviews with 6 college students that I recruited from the Gallaudet University community who were all deaf or hard of hearing. My results, I found that the communication experiences of deaf people during the pandemic, because of their hearing loss, was affected positively by people who adopted pets, and it improved their mental health during the time of the pandemic. For background, my study looked at an underrepresented community of deaf and hard of hearing people who have many situations unique to the pandemic, including an increased development of stressors related to communication because of mask wearing, because mask wearing impedes the use of ASL, which really involves using the face and mouth shapes of sign language, and which means that the mask is impeding that use. I also looked at to see the unique, diverse family and home dynamics of deaf people and language access, cultural identity, and the stigma related to being deaf. A lot of these issues that are experienced by deaf and hard of hearing people around the world, and including difficulty getting access to health information and discrimination and communication affected by language barriers. One study that looked at deaf families from Ghana during the COVID-19 pandemic found all 3 of these factors. This is continuing the background of my study. Part of the isolation comes from approximately 90% of deaf people are born to hearing families, which leads to the deaf person being the only person who signs in their family, which leads to language deprivation and information deprivation. For example, some places may not provide interpreters while they are producing health information that is life-saving health information. So animal companionship is known to help mental health challenges historically through animal companionship. Human-animal interaction studies, or HAI, these were done pre-pandemic, were known to have a positive effect on mental health and used as a coping mechanism to reduce the triggers of and symptoms of the effects of depression, anxiety, stress, and loneliness. And that, as an example, by increasing oxytocin. And studies also show that companion animal caregiving helps owners maintain a regular schedule, experience love and compassion, and experience a sense of life purpose. There is not much research at all on deaf and hard of hearing people using animals as companions in the HAI literature. Most of them have to do with deaf people using animals as service dogs, like hearing dogs. and not as companions. So my question was related to, do deaf and hard of hearing people experience the benefit of companionship similarly to hearing people? This is the methodology that I used, focused on a qualitative method seeking to understand people's beliefs, attitudes, and behavior during the interaction. And how does animal companionship impact mental health? I wanted to look at both groups. I recruited students through flyers that were posted on social media and also printed and posted around campus. I recruited 9, interviewed 7, and ultimately 6 were chosen for my study. The interviews were semi-structured with open-ended questions, and I used autoethnographic techniques, or as well to as the interviewer as one of the subjects as well. Then I interpreted through a phenomenological study lens to really focus on the description and examination of personal life experiences. My results, I found that there were 5 predominant themes. The first one being transitioning from face-to-face interaction. And then the first 3 were really faced by all people during the COVID. And then the last 2 were really unique to deaf people, and really unique to deaf people's experience during the pandemic, especially related to language access and stressors unique to deaf and hard of hearing. So then that whole adoption of, the whole process of adopting an animal, a companion animal, I looked at their thoughts before and after that adoption process during the pandemic. And all of my participants reported an improvement in mental health compared to before they adopted an animal during the pandemic. They all reported decreases in stress, anxiety, and loneliness. And they all reported receiving support and emotional support from that stress and anxiety after they adopted their animals. So the first one being the transition between face-to-face to remote. And then the unique factors related to having a deaf or hard of hearing identity. Then pet adoption and the significant relationship between animal companionship and mental health. I did find unique challenges faced by deaf and hard of hearing people during COVID-19. I found that the identity as a deaf person was impacted during COVID-19. A lot more. I found that of my participants, about half of them lived with hearing families who don't sign during the pandemic, and half of them lived with signing families during the pandemic. So, and what I found that there was a difference between families who signed and families who did not sign, and the deaf students' experiences living there during the pandemic, because they had increased communication stressors at home as well as outside of the home with masks. So the students who lived in families who don't sign during the pandemic reported increased stress, anxiety, and loneliness inside the home as well as outside. So it was part of the characteristics of the pandemic, but also then being home almost basically alone during the pandemic. And the increased feelings of stress, anxiety, and loneliness being there at home where no one signs, compared to being on campus at Gallaudet where communication is open and everywhere. I also saw that the
I'm gonna
animals.
have to jump in and say we probably have like 1 more minute.
Oh, I lost the interpreter for a second. Oh, thank you. 1 minute. Got it. So I'm going to jump to limitations. Of course, I had a small sample size, and they were only college-age students compared to the worldwide population of deaf and hard of hearing people. So I would recommend, and I would like to see in the future, also having longer interviews as well as having diverse age samples. But because of the short interviews, I could have missed some of the themes. And I would also like to see more HAI research related to deaf and hard of hearing people as well. Especially I'm interested in, can animal companionship support mental health and resiliency during times of hardship? And here are my acknowledgements. I would like to acknowledge Dr. Kara Miller as my second researcher and Dr. Deb McCall as my third researcher. And this is the inspiration for my study, is my cat Luna. And I definitely experienced similar feelings myself as my participants. And that caused me to ask the question of how common was that experience for me as a deaf person? Thank you.
That was fantastic. That was absolutely fantastic. So, okay, we are going to quickly shift gears and
there she is. There's my cat.
All right, we're going to shift gears, and is there somebody that would like to go next, or do you want me to just call on?
I can go next.
Okay.
Great. Okay. I will share my screen.
Okay. Let's see.
So, can everybody see this okay?
Let me work on being able to see you and take Haley off. 1 second. I figure out where she is.
Dr. Kogan, can you, we need to make sure that we still have an interpreter on screen.
Well, you are.
Right, we're switching interpreters. Do you see the second interpreter?
Oh, okay.
Let me see.
Yeah, I can see the, I can see Billy. Yeah. Okay, but I can't see Rebecca. Rebecca, can you start?
Yeah, absolutely.
Let me make sure, maybe when you start talking, but no, you didn't. Oh, yep, there you are. Perfect. Okay.
Awesome. You can see my screen okay and everything?
Yeah, that looks perfect.
Awesome. So, hey everyone, I'm Becca, and I'm going to be presenting on my doctoral dissertation, which is in progress right now. I just finished up my second year of my program at the Michigan School of Psychology. So my data collection is going to begin in the fall. And so because this is in progress, I'm going to talk about the research base that I found so far. So my chapter 2, my literature review, and then I'll talk a little bit about my chapter 3, so my methods and procedures and what I plan to do in the fall. And I was really interested in this topic, being a doctoral student myself and knowing how stressful the pandemic has been on my education, as well as how my 2 cat companions at the bottom have really helped me during this time. But to my surprise, there's actually no research looking at doctoral students as a population of study in the companion animal literature, or how, companion animals have impacted the lives of these students. So, as we know, the pandemic has been a very novel and stressful experience. It's actually been reported as a collective trauma experience, triggering a lot of mental health struggles through fears of infection, isolation due to social distancing, financial concerns and things like that. And this has actually impacted graduate students, specifically doctoral students, even more, because even before the pandemic, they were significantly more stressed and had higher anxiety and depression compared to other levels of education and just the general population. So, and those things, of course, negatively impact doctoral students' well-being. And then the pandemic happened and sort of additional stressors have been added on top. And some of the stressors that doctoral students have reported were things like more mental distress, a really difficult time with work-life balance, personal and professional losses, as well as that loss of social support and connection with others. And even before the pandemic, doctoral students have ways of coping with these things before and after. And so some of the things that were really helpful for coping was social support, which of course was more difficult through periods of isolation with the pandemic. And exercise, problem solving, and other methods of self-care were also ways that they would cope with stressors. And so because these things, doctoral students and companion animals haven't really been looked at together, I'm going to talk sort of in general, the benefits to well-being from companion animals, some risks, as well as benefits and, potential distress after COVID occurred, and talk about how maybe doctoral students could be connected to these things. And hopefully that's what I can find. So overall, the human-animal bond is very significant for positively impacting well-being for owners. And a lot of the research supports that the stronger the bond, the more the individuals who have companion animals will benefit. And of course, that bond is built through interacting and spending time over just the simple presence of an animal. So those interactions really help build the bond. And another thing that I found is that animals actually facilitate social support for owners. So not only do they emotionally, support them, but they increase human interaction. So through dog walking or just having topics of conversations to share together, animals really can facilitate even more social support. And actually there are benefits to psychological well-being too, through emotional support, increased quality of life, actually improved physical health through exercise like dog walking. And animals have helped people cope with mental health disorders, so reducing symptoms of anxiety, depression, suicidality, post-traumatic stress, and loneliness. And of course, there is going to be mixed research. And so some of the mixed research I found about companion animals were a couple studies had talked about higher psychological distress found among companion animal owners, which is almost like contradictory to what you would think. But of course, mixed research is going to show up. Some people reported increased emotional stress, or, animals can be costly at times. And of course, inevitably, there can be the loss or death of a companion animal, which is very difficult and hard to cope with, among other stressors. And so then with the onset of the pandemic, people have reported increases in well-being through emotional and social support during that lockdown period. There's that period of quarantine really allowed people to strengthen that bond with their animals, helped people with feelings of loneliness as well. And that attachment came up again of those stronger bonds really helped people benefit. So the more attached they were to their pets or their companion animals, the more benefits they felt, as well as helping cope with mental health concerns that were exacerbated with the stressors of the pandemic, and things like that. And of course, some distress was reported as well. So animals with existing behavioral concerns were exacerbated, increasing stress for owners. There were fears of high abandonment rates because of the surge of adoptions that occurred during that quarantine period. Worries about finances or their ability to care for animals, or the availability of vet care, food, things like that. And something that was proposed after the pandemic was something called psychological vulnerability in companion animal owners, which is companion animal owners being more vulnerable or more prone to stress or mental health problems through, external validation as a source of worth or things like that. So I just found that really interesting, that being proposed after the pandemic, and what circumstances really led researchers to sort of come up with this in companion animal owners compared to non-owners. So all of that being said, so my plan is to use the Transcendental Phenomenological Model by Moustakis, a qualitative approach to really uncover that subjective experience of this phenomenon and the meaning behind it for each person, but also like collectively through interviews, in-depth interviews. And I really am I'm using a qualitative methodology because the mixed research shows that there's some nuance to these relationships. And so by taking this approach, I'm hoping to really uncover some of these nuances, but also explore how companion animals impact the lives of doctoral students and really fill that gap since it hasn't been examined yet. So overall, that's sort of the research base that I have found so far and my plans. But yeah, so thank you very much.
Fantastic, Becca. Thank you so much. Okay, who would like to go next? Or I could just call on. So either one of you want to go next? Or Pascal, do you just want to go?
Yeah, I can go next.
Okay.
Can you see my screen?
I can, yes, and I can see you, so we are perfect.
Perfect. Yeah, welcome from Switzerland. My name is Pascal Kinsey, and I would like to present you our recently published paper in Scientific Report, Effects of Animal-Assisted Psychotherapy, Incorporating Mindfulness and Self-Compassion in Neurorehabilitation. We performed a randomized controlled feasibility trial. Acquired brain injury is a globally significant public health issue, and psychiatric disorders often co-occur with an accumulation of depression and post-traumatic stress disorder. Transdiagnostic psychotherapeutic approaches are increasingly used in neurorehabilitation to address psychological distress. However, although effective, they are usually challenged by low adherence to treatment and high attrition rates. Animal assistance is currently discussed to increase the acceptability and effectiveness of psychotherapeutic interventions by enriching the therapeutic setting to a context of normality and non-evaluation, which helps the patients to feel secure and accepted. Although first evidence regarding the benefit of animal assistance in psychotherapy exists, research of differences in application and modes of action regarding animal assistance is limited. Therefore, we conducted a study to first assess the effectiveness of an injury-adapted mindfulness and self-compassion-based program for patients with acquired brain injury, and also with and without animal assistance to assess effects of animal assistance. Therefore, we recruited 31 neurorehabilitation inpatients with acquired brain injury and psychological difficulties meeting the other inclusion criteria. We then randomized them according or stratified to their Montreal Cognitive Assessment score and their age, to either the animal-assisted mindfulness and self-compassion-based intervention or the standard mindfulness and self-compassion-based intervention without animal assistance. Primary outcome was the Global Severity Index of the Brief Symptom Inventory, which was assessed at pre-treatment, post-treatment, and follow-up treatment. Secondary outcome was the visual analog scales, in fact, 7 visual analog scales regarding feeling safe, accepted, comforted, at ease, motivated, hopeful, and grateful. And they have been assessed pre-session and post-session, as well as adherence to session and attrition. The intervention, you don't have to read this all. You can just Google our paper and you will see everything there. What is important is that it was an intervention which dured 6 weeks with 2 sessions per week, and was with main components of the mindfulness-based compassionate living, mindfulness-based stress reduction, mindfulness-based cognitive therapy, and attachment-based interventions. And the only difference between groups was animal assistance. Otherwise, they performed the exactly same treatment protocol. And what was also special is that it was injury adapted to brain injury. Therefore, the sessions were highly structured, and they got memory cards after every session and so on. The results regarding our primary outcome, effect on general psychological distress, was that we found a significant decrease over time in both groups regarding the pre to follow-up time span and the downtrend from pre to post treatment. And no significant difference between groups, nor an interaction effect, indicating no significant difference between the animal-assisted and the standard mindfulness-based mindfulness and self-compassion-based intervention regarding reduction in general psychological distress. When we zoom in and come to the secondary outcomes, we can see that patients in the animal-assisted group felt significantly more secure within sessions, as you can see here. When compared to the standard MSCBI, they feel significantly more comforted, accepted, motivated, grateful, and at ease. Adherence was significantly higher in the animal-assisted mindfulness and self-compassion-based intervention when considering all patients allocated to treatment. And attrition did not differ significantly, although it was lower in the animal-assisted mindfulness and self-compassion-based intervention. Reasons for dropping out were too many ongoing stationary therapies in the animal-assisted group, and in the standard that the program in this setting was not convenient, that the intervention was not needed, that they had no time for sessions, or that it was too confronting. Yeah, both MSCBIs with and without animal assistance are feasible and effective in reducing psychological distress in patients with acquired brain injury. Although our results have to be replicated with bigger sample sizes and a no treatment control group. The significant changes within sessions, mainly in relationship-based emotional states as feeling secure, accepted, comforted, and the higher treatment adherence suggest additional effects of animal assistance. Animal assistance might increase acceptability and patients' commitment to psychotherapy. And of special relevance for future developments of animal-assisted psychotherapy will be, in the context of cost effectiveness, will be the aspect of differential indication, which means for whom an animal-assisted approach is superior to a standard approach. And animal-assisted psychotherapy is thought to be especially helpful for patients experiencing difficulties in interpersonal relationships and or survivors of developmental trauma. And for future trials, we recommend to assess patients' characteristics such as premorbid social and interpersonal functioning, attachment style, developmental trauma, independently of somatic comorbidities, supporting guidelines for differential indication. Yeah, and one very important aspect is that, the therapy animal is not our instrument, but an individual which can enrich the therapeutic process through unexpected moments of joy, gratitude, and love. Thank you very much.
Thank you, Pascal. That was fantastic. Certainly educational. Okay. Okay, let's turn things over to our last presenter. So, Becky, do you want to go?
Yep.
Okay. Perfect.
Okay, you guys can see that okay?
Hold on, let me make sure I can see you. There, perfect.
Okay.
Okay, go ahead.
Okay. Hi, my name's Rebecca Fileggi, and I'm presenting on the impact of the COVID-19 pandemic on the mental health of swine veterinarians. I was part of a research team and with Lori Kogan, Corey Busolari, Jennifer Curran McCallick, and Wendy Packman. They had reached out for people if they were interested in helping analyze some data. So that's how I got involved with this project. So to tell you like why this research is important, it's also important to explain the relevance of how veterinarians are impacted with their mental health. So at least in the United States, suicide is the 10th leading cause of death amongst people. And in general, those in varying career fields are at a higher risk for mental health problems or risk of suicide. And veterinary professionals are in that category when compared to the general population. So there is research out there that has looked at veterinarians' mental health as a whole group. However, not as much is known about a specific group of the veterinarian population, including swine veterinarians. So during the COVID-19 pandemic, US slaughterhouses were temporarily shut down because a lot of workers contracted the virus. So as a result of shutting the slaughterhouses down, there was a need for mass swine depopulation since, the swine could not be sent to the slaughterhouses to use as food. So the purpose of this study was to qualitatively assess how the pandemic-related depopulation efforts affected the swine veterinarians. Our primary research question was, what effects did the mass depopulation efforts that emerged during the COVID-19 pandemic have on the swine veterinarians' well-being? We had predicted that their well-being would be negatively affected due to engagement in it. We did a semi-structured interviews. So there were 23 swine veterinarians recruited for this study. I should note that there were a number of swine veterinarians that were directly involved with the depopulation efforts, and then there were also some that were not directly involved. So they had known other veterinarians that participated in it. So they were asked varying questions. Some examples were, did the event at all impact your relationships with friends or family? Do you think that this event impacted the farmers or producers that you worked with? And then what would you want people such as your peers or the public to know and understand about this event? So the 23 veterinarians answered those questions. They were recorded, and then what we did as a team of student researchers, we went through all of their responses and coded the data and found overall themes that were present within the interviews. And the process we used was Braun and Clark's 2006 thematic analysis process. So as we all did this independently on our own, and then there were 2 teams of students, we came back together as a group to go over the themes and codes that we had found to ensure intercoder reliability, so that, you know, if a code wasn't quite matching what the data was saying, we would either get rid of it or try to find a better fit. So there were a lot of different themes that came about through this analysis. However, I'm just presenting on the ones that seemed most relevant. So in table 1 right here, you can see the 4 main themes that I wanted to report on. It was evident that the swine veterinarians did experience some mental health challenges. And I tried to pick out the best quote from participants that exemplified this theme. So one of the swine veterinarians had said it looked like a post-traumatic stress disorder. People became nervous, hard to sleep, irritable, just all of those type of syndrome disorders secondary to the stressful situation. They didn't want to come to work. They were sad and kind of aimlessly moving through the day, not excited about their jobs. And with the people experiencing mental health challenges, it was clear that there was a moral and ethical dilemma amongst this process, because if you think of, you know, the veterinary profession, it's to ensure the well-being of animals. It's not to, you know, euthanasia is usually used as a last resort if an animal is not doing well. So the problem that they faced here were that, you know, they're supposed to help bring swine to a place where they can be used for food. However, in this process, perfectly healthy swine were getting euthanized. So that kind of goes against everything that, you know, veterinarians are trained to do. So that posed a lot of stress for people. The quote that I found there was, "We go to vet school to save animals and to make them healthier and grow better, not to bury them in a hole." So that definitely brought about some problems for the people that were involved in this process. However, there wasn't really any other decision they would report. You know, they were trying to do the best they could in a stressful and unknown situation. And due to, you know, the moral dilemmas, the mental health challenges, the swine veterinarians would report on different ways that they coped with everything. So this was the best quote I had found, but so somebody said, "I actually had a breakdown. I did get into therapy and got prescribed medications to help deal with the emotions surrounding the event." Other veterinarians reported they found support from other colleagues, from their families. There was some of them were participating in like a church group. So it was evident that, you know, the less alone they felt, the better off they were. And then a last main theme that was demonstrated in the data was, you know, the pandemic. I think somebody had mentioned this was a collective trauma for everybody. It was such an unknown. Nobody was prepared for what was going to occur. So the same goes for those in the swine veterinarian profession. They mention, a lot of them at the end, there's a need for future guidance on how to deal with this big crisis, and research on what are the best methods to carry out mass depopulation. So somebody said, hopefully we can take back to the ASV and AVMA to better prepare ourselves in the future, because, you know, it really just highlighted that we were unprepared to deal with something like this. And there are looming diseases that are going to put us in the same scenario. So, you know, this isn't going to be the last of, health concerns coming up. So, you know, there needs to be more guidance in the future to help people. So in terms of the discussion, it was reported that psychological distress was experienced by many of the swine veterinarians. And then also, it's important to note that some of the participants did not feel supported by the greater vet community and governing entities. It was interesting that there was some of the participants mentioned a differentiation between like the general vet population, so like small animal vets versus the swine vets. There's kind of a stigma attached with swine veterinarian practices. So they didn't always feel the most supported throughout this process. And then our results concur with previous research suggesting that individuals experienced emotional distress due to euthanizing animals on farms. And this study also confirms the need for those involved in the mass depopulation efforts to be further supported. So it's important that future studies evaluate how to effectively address mental health concerns of those involved in depopulation efforts, and also future research needs to establish empirically supported depopulation efforts that take into consider, you know, animal welfare, how feasible the process is, because throughout the data, you know, there are concerns about like, what about money? What are they going to do with all of the leftover dead carcasses? And then also the lasting effects on those involved. You know, this study definitely resulted in psychological distress. These people, they don't go to school for this, they're not prepared for any of this. So how they can best be supported throughout the process and helped afterwards is crucial. So, and I also just want to thank everybody on the team. I think I saw Chris in here. It was a super impactful experience for me to be a part of this research. So thank you everybody for also showing interest in this line of research.